Thank you for joining us in our video series on how health centers can address the critical issues of HIV, hepatitis C, and sexual health. Fully engaging our patients in all important health issues is a hallmark of a true patient-centered medical home. In this final video, we'll hear from a physician who is expert in why routinely discussing and documenting sexual history is so important, and in how the dynamics of such discussions should proceed.
Primary care clinicians really need to get to know their patients, and at the core of our lives is our sexual health. Studies have shown that people want to talk to their clinicians about sexual health, but the clinicians often don't discuss it. So we need to set the right context and talk about why it's important to talk about sexual health, that people want to avoid risk of sexually transmitted diseases and HIV, but people also want to talk about healthy sexual function and satisfaction, as well as their reproductive desires and concerns. Frequently when I talk with groups about taking a history of sexual health, a lot of clinicians are very concerned about the time it takes. And it does take time to discuss intimate issues with patients. So what we've done is we've developed a toolkit on taking a history of sexual health that really looks at starting with some focused questions, such as which relate to behavior and risk, and then broadens out to ask more about sexual function and behavior. So 3 simple questions that you might want to start out with are you sexually active? Do you have sex with men only, women only, or both? And how many sexual partners have you had in the last 6 months? These questions give us a sense of what your sexual risk is and what your sexual behavior is that allow us to go on and broaden the discussion and tailor it to the needs of individual people. When we introduce programs for sexual health, it's important that we do so emphasizing the importance of putting them in context and teaching clinicians and others in the health center that when we talk to people about sexual health, we have to assure them that this is something that we do routinely for all of our patients, and also that we make no assumptions, that we don't make any assumptions about who we ask these questions of and who we don't, because they're questions that need to get asked of everybody.
Health center teams should, of course, be trained in sexual health dynamics. NACHC and the National LGBT Health Education Center have created a toolkit, available elsewhere on NACHC's website, containing excellent resources for discussing sexual health and taking routine sexual health histories.